I'm James Snow, and I'm the Acting Program Director for the Masters of Science in Health Education and Integrative Health that we are launching currently at the Tai Sophia Institute.
So James, can you tell me why Tai Sophia has decided to offer a health education program?
Yes, we're in the middle of a national healthcare crisis where we have enormous healthcare expenses, but Americans continue to suffer and die from a wide variety of preventable diseases, including heart disease and diabetes and obesity. And as a practitioner, I often have found myself one-on-one telling people the same thing over and over again about various behaviors or health behaviors that can improve overall quality of health and wellness while limiting and preventing disease. However, realistically, there's an enormous expense with people going to practitioners for this kind of feedback, and it may not necessarily be the key approach to giving this kind of care. So health education is actually a way to reach the community, and health education at its heart changes behaviors within the community through the process of education. And at this point in time, Tai Sophia, which has predominantly been a one-on-one, predominantly had degrees that focus on one-on-one care, is now moving further towards a community-based education for healthcare, health prevention, and overall enhancement of well-being.
And what would a student learn in this program, and what makes Tai Sophia's program different than other health education programs around the country?
Well, health education programs in general are predominantly about education. You really learn how to assess a community, assess its needs, to design, implement, and reevaluate educational programs. So in all health education programs, you really learn how to design really focused educational programs to help people make informed changes in behaviors. The additional piece that Tai Sophia adds is that we are really focusing on integrating our areas of expertise, which is the areas of integrative health and complementary medical practices, into those educational programs. So within our program, you'll really learn an evidence-based understanding of a lot of complementary medicine type practices, such as yoga or meditation or Tai Chi, for example, that could be incorporated into a health education program for the broader community.
Who would be a prospective student for this program?
So a good student for this program will be somebody who was really inspired to make a difference in their community, somebody who cares about health and wellness, and somebody that has a passion for education. And in the end, this program is going to enable you to empower other people to make meaningful changes in their lives.
Great. And where can someone go if they wanted to find out more information about the program?
So there's information about the program on our website, www.tai.edu. And we're also going to have a series of classes this fall that are going to highlight health education, help you understand a little bit more about what a health educator does. And I would encourage you to, again, go to our website and look for announcements around those classes.
Great. Thanks, James.
You're welcome.